So today we have taken a reading from the OET official site. Thank you, OET, for allowing me to use this particular text for teaching purpose. And the heading of the text is, main heading is fractures, dislocations, and sprains. That is from the very first sample material given in the OET website. Now, second, skimming for focusing on subtopic of each paragraph or the text. Text A, here it is classification, which is also including definition, cause, types, all those things. And text A gives classification. Text B gives assessment and management. There are some other subtopics as well, I'll tell you. And text C gives medication or the treatment. And text D gives procedure, plaster, backslab. Now classification, assessment and management, medication, procedure, plaster, backslab. When we say assessment and management, what do you understand from assessment? Diagnosis or investigation? What are the thoughts or the words come to your mind? Swelling, yes, swelling, yes.
Sometimes hematoma will be there.
Okay, all these things you have to recall. That's all. Just visualize. It doesn't take long time. Just to visualize a particular patient, or if you have come across recently somebody who is fractured and crying out of pain or something like that, or he has come after a band-aid treatment, just imagine that person. That will help you a lot to understand. Okay, there is a link between all the four texts. So third one is skimming for keywords, phrases of each paragraph. That is to say, main heading, subheadings. So we have to, of each paragraph or text, you have to look at the main heading and subheadings. At times there will not be main headings. So what are the keywords here? Text A.
Dislocation.
Yeah, exactly. Yeah, fractures, dislocation, and sprain. And this is classification or definition, and cause is given there. This is also description, but then they have classified the whole thing. So when you know something about the types or classification or cause or something of that sort, you should definitely launch here and you can answer from there. Now the second one, simple fracture of limbs is the main heading, simple fracture of the limbs, and immediate management is the next subheading. Clinical assessment, examine, check whether, check something, management. Okay, clinical assessment, examination, checking, and management. Just I gave a short heading like assessment and management, but you should go through these subheadings so that immediately you can launch whether it is under management or whether it is under examination, clinical assessment, or immediate management. Looking at the question statement, you will be able to identify these things. Text C, medication or treatment. The main words are drug, form, strength, route of administration, dosage, and duration. These are the main words. And text D, the main thing is plaster, backslab for arm fractures. That's the main thing. So there is no other main heading here. So you can definitely understand when you speak of plaster, backslab for arm fractures, the procedure is given. There is a link between, beginning and end. It progresses. So they are giving you step by step what to be done: wrap, measure, immerse, ensure, and lightly mold. Although wrap, crepe, bandage. So there is a procedure given step by step. So these are the four paragraphs. Now, reading strategies and tips. First, step 1, skimming for general idea. Main heading, main topic, fractures, dislocations, and sprains. This is the main heading of today's reading. And now, skimming for general idea also includes focus, text, topic of each text, classification, assessment and management, or diagnosis, you can call it, treatment, and fourth one is procedure of plaster, backslab. So this is the main idea what you have to skim for. If you do this procedure properly, as well as I told to the visualization and the foreseeing and visualization and investigation, asking yourself several questions about the whole thing, about the main topic, you will definitely get most of the answers from paragraph 20, even without reading the whole text. So just to know, there is a sequence. Now, could you just go through this? Can you take a piece of paper and just make 4 columns? There are only 2 columns here. Please make 4 columns. Take a piece of paper or on your notebook, make 4 columns, parallel lines. There are only 2 columns here. We need 4 columns. One is for classification. Other one is for assessment and management. Third one for treatment or medication. Fourth one for procedure, the bandage procedure.
A fourth one for the
bandage, procedure. Procedure of applying bandage. You can write anything that you understand. No? So you have to understand in your own way. There are only two columns here. I need 4 columns for you. First, second, third, fourth columns. Have you written 4 columns?
Yes, sir.
Yes,
Yeah.
father.
First, what is the first heading on top?
Classification.
Yes. Next.
Assessment.
Assessment and management.
Yeah. Next.
Treatment.
Yes. Next.
Treatment.
Procedure.
Procedure. Yeah. That
Procedure.
is, in bracket, you can write bandage or plaster, backslab or bandage, whatever. Now, could you just, where does this come? Dislocation,
Classification.
classification. Okay. Types of fractures.
Classification.
Classification.
Plaster, backslab,
Procedure.
Procedure.
splinting,
Procedure.
procedure, morphine,
Morphine. Treatment.
Treatment.
Naloxone
treatment.
naloxone, sling,
Procedure.
swelling.
Assessment
Management.
Okay. Assessing a assessing. Padding,
Procedure.
procedure. Cause of fractures,
Procedure.
cause of fractures,
Assessment.
remove jewelry,
Assessment.
remove jewelry,
Assessment.
Procedure.
elevate the limb,
Bandage. Assessment.
Management.
allergic,
Treatment.
Medication. Assessment management.
yes, it is not medication, it's assessment management. When you manage your condition, what condition or what disease,
Assessment.
assessment, yeah.
Assessment.
Dosage,
Medication.
analgesic,
Medication.
checking an injury,
Treatment.
checking an injury.
Assessment.
Assessment.
Yeah, great. You are exactly right. Classification, all these words are in classification, assessment and management, treatment, medication, procedure, plaster, backslab. So almost we have said everything. Right. And identify and list the synonyms and synonymous expressions. Text here, synonyms and synonymous expressions. Now you see cause, occur, getting bigger, swelling, pain relief, morphine. Morphine, when they say morphine, you should understand it is pain relief. Injured limb, fractured limb. Okay, limb, leg. Say these are the synonyms being used. Injuries, fractures. Upper limb. This is what is in the question on the left side. It is the question statements, and this is in the text. Upper limb, arm. Arm is used as upper limb means arm in the text. And elevate the limb. Elevate the fractured leg. So these are the synonyms or synonymous language used. So fourth one is stem words, keywords of the question statement. Let's see what are the keywords in the question statement. We have seen the text. These are the first 7 questions. Now you'll have to tell me from which category, okay? Now, procedures for delivering pain relief, A, B, C, D. A is pain relief. Where it comes?
Medication.
Medication, yeah. C, treatment and medication, exactly. Yeah, the procedure to follow when splinting a fractured limb.
D.
2, the procedure to follow when splinting a fractured limb. Splint. D, exactly. See, you need not even read. You have not seen into the passage at all. We have just glanced through. What to record when assessing a patient? B, assessment. Okay. And the terms used to describe different types of fractures. Yes. The practitioners who administer analgesia.
Treatment.
Yeah, treatment. Yes, exactly. What to look for when checking an injury?
B.
Checking.
B. Assessment.
Yeah. How fractures can be caused?
Definition A.
Yes. Here, cause also comes over there. There's a description also is there included. That's fine. But then you have done almost 99% exactly correct. So you see, you do not even read the passages once you understand the heading or the main idea of the paragraph, and you'll be just going through, and first 7 answers can be completed within a minute. There is no issue at all, because just see the stem words in the question statement. So 18 to 14 I am taking up just to match the text. Okay, now we are not going to answer anything. Just tell me to which it belongs to. One sec, excuse me. Yeah, now Elevate a patient's fractured leg. Tell me A, B, C, D.
D.
D. Okay.
Okay.
And here morphine.
C.
C. Extra padding.
D.
And respiratory depression.
D.
Yeah, it will be with D. Okay. Plaster backslab. That's okay. One confusion is there. Plaster backslab.
D.
Yeah.
D.
Allergic.
B.
B. Yes. What condition? What condition? What condition means?
A.
No. You have to know what condition, what disease, what problem. Where do you get it?
Assessment.
Yeah, it's in the assessment. Yeah, B. Yes. Exactly. Now cause
A.
A, and limb should be elevated.
D.
A plaster black slab.
D.
Check the swollen limbs.
B.
B. Plaster back slab.
D.
D. Dosages of pain relief.
C.
How beautiful it is, how simple it is. So you know immediately where to go for the answer. Once you know the heading and subheadings, that's why I said skimming. This is the strategy of skimming. That's why I've taken a step ahead. In the previous video, I have not checked this way. Now you see, I'm telling you how immediately you can launch or dive into soup into that particular area of the answer. If at all you need a clarification, and most of the answers you'll be able to do even without reading the details. Okay, text versus question analysis. Now let's see. These fractures occur following direct or indirect injury, and these words, it often results from injuries. This says this is cause and effect language. The language used here is cause and effect. This is a classification paragraph, but the nature of the language is cause and effect. So the terms used to describe different types of fractures, already we have seen the answer, it is here. Okay, text A. See, terms used to describe different types of fractures. 1, 2, 3. And now how fractures can be caused. Caused synonym used is occur. Okay, cause, occur. So that's also we have seen from this paragraph, just to say A, B, C, D, that's all. The 15th question is falling on an outstretched hand is a typical cause of a dash of the elbow. Here it is. Falling on an outstretched hand. This is a typical cause of, what is the answer? Dislocation. So don't write elbow, yeah. Here I want to highlight one thing. Don't write elbow dislocation because this is an example. Example given for dislocation. So don't use that particular limb which is used cause of a dislocation of the elbow. Okay. I'm just checking, not with the order, but only those answers which have come. Only 3 answers are there from A paragraph. Now we see here you have, though I said assessment and management in short, here you have immediate management and management I clubbed together. Clinical assessment, examination also I can put into a clinical assessment and check whether that's another thing like a guideline for you. Now let's see what to, now I'm going into maybe I think 6 or 7 answers are here in text B. Okay, what to record when assessing a patient, assessing we know where it is, and what to look for when checking an injury. Checking is a check, the word is there. And 7 other 3rd and 6th from the first part. And 8, what should be used to elevate a patient's fractured leg? What should be used? Elevated the limb. Elevate the limb. Sling for arm injuries, a pillow for leg injuries. What should be used?
Pillow.
A pillow, yes. So clear it is, a pillow. And what analgesic should be given to a patient who is allergic to morphine? And they are if allergic to morphine, use fentanyl. Okay, so clearly given there.
Fentanyl.
What condition might a patient have if a severe pain persists? What condition?
Compartment
Syndrome. Yes. And upper limb fractures should be elevated by means of upper limb means arm. Elevation by sling. So direct.
A sling.
Yeah. Check to see whether swollen limbs are dash in size.
Getting bigger.
No, swollen means getting bigger.
Getting bigger.
Throbbing.
Throbbing. Yeah,
Throbbing.
swollen means getting bigger. Yes. Okay. And text C, medication or treatment. Check the questions now. Yeah, procedures for delivering pain relief. that we have seen just to match the heading. The practitioners who administer analgesia, that's to match the text, that's all, paragraph. Now, ninth one, what is the maximum dose of morphine per kilo of a patient's weight that can be given using the intramuscular route? What is the maximum?
0.2.
0.2.
0.2.
Milligram per
Why not 10?
Here mentioned to max
based on weight.
0.1 to 0.2.
Now they are asking what is the maximum dose of morphine per kilo.
kg.
Based on
Then, but then here they have mentioned to a max of 10 mg. I have put in red marks. Why not? They are asking what is the maximum dose of morphine. Here the maximum is given 10.
They are asking per kg.
Kg, they are asking per kg.
Per kilo.
They are asking per kg.
Okay, that you have to understand. Definitely, as health professionals, maximum is for whatever the kg, whatever the repetition, it should not exceed 10. But per kilo it is, per kg it is, maximum is 2 mg. And these are like, the questions that used to be asked to the students, primary students. They have given 1 to 2, 0.1 to 0.2 adults mg per kg. They are asking what is the maximum dose of morphine. Minimum is 1, maximum is 0.1 and maximum is 0.2.
0.2.
Should not be asking you these simple questions, right? What should be used to treat a patient who suffers respiratory depression? Respiratory depression.
Naloxone.
Naloxone.
Okay. And patients aged dash and over shouldn't be given the higher dosage of pain relief. This is one method they ask.
70 years.
70 years.
Yeah, patients aged and over shouldn't be given the
Above
higher.
7 years.
Yeah. So you see, shouldn't be negative meaning is used here. Use lower end of dosage range. You have to use lower end of dosage range in patients of 70 years. Now here they said you shouldn't be given the higher dosage of pain relief. So negative meaning is being used. Okay, last text D procedure, plaster backslab. The procedure to follow when splinting a fracture, that is just matching. Okay, sorry. Now 10th one is which part of a limb may need extra padding?
Bony prominence.
Bony prominences. These things I think you must know. I don't know. I'm not a health professional. You should be knowing these things by general knowledge. And what should be used to cover a freshly applied plaster backslab?
Crepe bandage.
Crepe bandage.
Crepe bandage.
Yeah, even without reading, you know these things, right? You should know, right?
Yes.
Yes. Make sure the patient isn't wearing any dash on the part of the
Jewelry.
Yes, any is already there. So same thing. Direct answers. And in a plaster backslab, there is a layer of dash closest to the skin.
Stockinette.
Stockinette means here you see this is not very direct. This you should understand. This is called presumption. When there is a procedure that begins, the wrapping begins in the first step. No, you start with the measure length of non-compression cotton stockinette from halfway. So he begins here. So closest to the skin means the first thing what you wrap is the closest to skin, right? Whatever you wrap first, apply first, that is closest to the skin. So they are testing you whether you can understand the process, the development. This is a process. 1, 2, 3, 4, 5, 6, 7, 8 steps are there, starting from the closest to the skin to the farmost to the skin. As simple as that. And A to B, the transition is very important. You know, A is a fast reading and B is not that fast reading. A, you have only 45 seconds per question. Here, B, you have almost 2 minutes. So always after A, take a deep breath. Okay. And there is time, definitely, I know you are completing it in 12 minutes or 10 minutes, A part, then you have a lot of time to spare to cool down yourself. And you have to slow down. In part A, you'll be on a fast track reading. So you have to slow down your brain as you reach part B. So transitioning from OET reading part A to OET reading B is very important. And reading part B, text.
The manual informs us that the blood pressure monitor, option A, is likely to interfere with the operations of other medical equipment. B option is may not work correctly in close proximity to some other devices. And option C is should be considered safe to use in all hospitals. Thank you.
Now, blood pressure monitor is the key word there, heading word, main word. And I have put here absolute. If you remember or watch my session on elimination method, and as I gave you the elimination method, I told the first one is eliminate the absolute. Eliminate the absolute. If there are absolute extreme options, answer options given, they can be eliminated immediately because that will never be the answer. That you can watch in the video. Link will be given in the description.
Instruction manual, digital automatic blood pressure monitor, electromagnetic compatibility. With the increased use of portable electronic devices, medical equipment may be susceptible to electromagnetic interferences. This may result in incorrect operation of the medical device and create a potentially unsafe situation. In order to regulate the requirements for EMC with the aim of preventing unsafe product situations, the EN 6060112 standard defines the level of immunity to electromagnetic interferences as well as maximum level of electromagnetic emissions for medical devices. This medical device conforms to EN 6060112:2001 for both immunity and emissions. Nevertheless, care should be taken to avoid the use of monitor within 7 meters of cell phones or other devices generating strong electromagnetic fields.
The paragraph structure here. Problem is blood pressure monitor is having the problem of electromagnetic interference. There is a grammar mistake, sorry, by mistake. And cause is electromagnetic interference. Effect is incorrect operation of the medical device and create a potential unsafe situation. Solution is the EN 6060112 standard defines the levels of immunity of electromagnetic interferences as well as maximum level of electromagnetic emissions for medical devices. That is the solution or the notice given or the manual instruction given. Now compatibility, this particular medical device conforms to this instruction, immunity and emission manual instructions. And caution is, nevertheless, it should not be used in close proximity with cell phones or other devices. See the structure, and once you understand this structure, once you are competent, so what happens immediately, you know, the question is asking about the solution, asking about a cause, or asking about compatibility, whatever. So immediately you can swoop into or just dive into that particular area of the text. So the manual informs us that the blood pressure monitor, what is the answer? We'll go to the paragraph. So you see, the manual informs us that the blood pressure monitor is likely to interfere with the operation of other medical equipment, may not work correctly in close proximity to some other devices, could be considered safe to use in all hospital environments. One I said already, the absolute is that all hospital environment, so it is eliminated. The other one is now instruction manual. What is the focus of this paragraph? Other devices or
Device.
yeah, one device. Which device? Please don't.
Blood pressure monitor.
Blood pressure
Yeah.
monitor.
Okay, so with focus is blood pressure monitor. So when blood pressure is monitor is focus or the main chief guest of the day, who should be focused in your answer?
Blood pressure monitor.
Blood
Yeah.
pressure monitor.
Now you maybe Mr. David is the patient who is approaching you, and there are many other patients in the ward. Now you are interested to take care of David. Are you concerned about David or other patients?
David.
David. So the one clue I am telling you, you have to focus on the focus of the paragraph. So here it is saying maybe susceptible to electronic interference. Now other option is it is likely to interfere with the operation of other medical equipments. Does it go well with the focus?
No.
No.
Yeah. If other patients are worried or if other patients have some issues, are you bothered about it? You are bothered about Mr. David, right? Your patient. So the focus is this particular instrument. So answer should be focused on this instrument. So this they are speaking about blood pressure monitor, this particular instrument. So they will say what are the manual instructions given for the functioning of this particular portable or this blood pressure monitor. And it says the compatibility, you know, this medical device conforms to the immunity and emission, manual instructions. So compatibility sets. So may not work correctly in close proximity to some other devices. Nevertheless, the caution is given. Caution is important always. Nevertheless, care should be taken to avoid the use of the monitor within 7 meters of cell phones or other devices generating strong electrical or electromagnetic fields. Answer is here, okay? You should not use it in the close vicinity of cell phones and other devices. Is it because the people are not able to use their cell phones because you are using this particular instrument in the hospital?
No, Father, because maybe we able to
Yeah.
record the blood pressure also.
Yeah, it's not bothered about cell phones at all. Bothered about the functioning of this. So if you are using it close to in close proximity with cell phones, your instrument blood pressure monitor will not function well. So may not work correctly in close proximity to some other devices, which is the paraphrasing of this last caution. Is that clear?
Yes, Father.
Yeah.
Yes.
Father.
Yeah, no, okay.
Yes, Father.
We'll come back if need be. Now I will not be going into detail or reading these things. This will be giving you as an assignment for you. I'll show you one more strategy over here. Maybe this one, just one you can read, just this one.
The notice is giving information about ways of checking that an NG tube has been placed correctly, how the use of NG feeding tube is authorized, which staff should perform NG tube placement, NG tube feeding, NG feeding tubes. Placement of nasogastric feeding tubes can have serious implications if undetected. Incorrectly positioned tubes leave patients vulnerable to the risk of regurgitation and respiratory aspiration. It is crucial to differentiate between gastric and respiratory placement on initial insertion to prevent potentially fatal pulmonary complications. Insertion and care of an NG tube should therefore only be carried out by a registered doctor or nurse who has undergone theoretical and practical training and is deemed competent or is supervised by someone competent. Assistant practitioners and other unregistered staff must never insert NG tube or be involved in the initial confirmation of safe NG tube position.
For example, here again there is a problem. There are solutions and things are given. And what is that highlighted green thing? Is it a problem, cause, effect, or solution?
Solution.
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 Exactly. Solution. Exactly. So the notice is giving information about ways of checking that an NG tube has been placed correctly. There is nothing to check. They don't speak anything about checking a tube which is already correctly placed. Then go and check it. It's a nonsense. In fact, it's nonsense now. Once you have placed it correctly, why should you bother now? How the use of NG feeding tube is authorized? How the use of NG tube is authorized is a process. How to use it? Okay, how the authorization happens? So there's a process. There is no process language used. I'm just giving you a hint. Here there is no process language used. Here there is a problem, cause and effect solution language being used. So the nature of the paragraph, if you know, immediately you know, just glancing at the paragraph, you will know second option is wrong. First option is not, doesn't make any sense. Second option is wrong. And so which staff should perform NG tube placement? Insertion and care of an NG tube should therefore only be carried out by the registered doctor, only by a registered doctor or nurse. Then again saying assistant practitioners and other unregistered staff must never insert NG tubes. So clearly they are explaining the solution, which staff should perform NG tube placement. Looking at that, immediately you can understand it's a solution. So it will be somewhere after the half of the paragraph.
What must all staff involved in transfusion process do? A, check that their existing training is still valid. Attend a course to learn about new procedures. C, read a document that explain changes in policy.
Yeah, you see, there is something must instruction is there. Check. Then one is to check that their existing training is still valid. Attend a course, read a document. Three things are said here. Yeah, please read.
Yes. Right patient, right blood assessments. The administration of blood can have significant morbidity and mortality. Following the introduction of right patient, right blood and safety policy, all staff involved in the transfusion process must be competency assessed to ensure the safe administration of blood components to the intended patients. All staff must be aware of their responsibilities in line with professional standards. Staff must ensure that if they take any part in transfusion process, their competency assessment is updated every 3 years. All staff are responsible of ensuring that they attend the mandatory training identified for their roles. Relevant training courses are clearly identified in Appendix number 1 of the mandatory training matrix.
Yeah, does it speak anything about a course or a document?
And nothing mentioned.
No word is mentioned about any course or document. So you see beautifully given here. So you can immediately understand what is the answer. And you know, modal verb must is used. And still valid is the validity of the training is the concept, validity of the training. And assessment is updated every 3 years. For example, OET, if you don't move to another country within 2 years, you'll have to update it again, appearing for the exam after 2 years. So updated every 3 years, so still valid, updated, the synonym expression used here. So immediately, you know, the answer is must be competent, must be competency assessed. Again says training should be valid, or your validity appears, must be aware of their responsibility, must, competency assessment is updated every 3 years, must. So the modal verb clearly indicates this is the answer.
The guidelines establish that the healthcare professional should, option A, aim to make patients fully aware of their right to a chaperone. Option B, evaluate the need for a chaperone on a case-by-case basis. Option C, respect the wishes of the patient above all else. Extract from chaperones guidelines for good practice.
Sorry.
A patient may specifically request a chaperone or in certain circumstances may nominate one, but it will not always be the case that a chaperone is required. It is often a question of using professional judgment to assess an individual situation. If a chaperone is offered and declined, this must be clearly documented in the patient's record along with any relevant discussion. The chaperone should only be present for the physical examination and should be in a position to see what the healthcare professional undertaking the examination or investigation is doing. The healthcare professional should wait until the chaperone has left the room or cubicle before discussion takes place on any aspect of the patient's care, unless the patient specifically requests the chaperone to remain.
The guidelines establish that the healthcare professional should aim to make patients fully aware of their right to a chaperone, evaluate the need for a chaperone on a case-by-case basis, respect the wishes of the patient above all else. Need not explain it. It is clearly given here. You have a contrasting word here, right? But a patient may specifically request a chaperone or in certain circumstances may nominate one. But when there is a contrasting word, the answer must be immediately after that. It will not always be the case that a chaperone is required. It is often a question of using professional judgment to assess an individual situation, case by case. Evaluate, assess, evaluate. Assess, synonym is evaluate. The need for a chaperone on a case by case. Assess an individual situation. Each judgment, professional judgment to assess an individual situation means case by case. Clearly given. So I don't want to go deep into it.
The guidelines require those undertaking a clinical medication review to option A, involve the patient in their decisions. Option B, consider the cost of any change in treatments. Option C, recommend other services as an alternative to medication. Annual medication review. To give all patients an annual medication review is an ideal to strive for. In the meantime, there is an argument for targeting all clinical medication reviews to those patients likely to benefit most. Our guidelines state that at least a level of 2 medication review will occur. That is, the minimum standard is a treatment review of medicines with the full notes, but not necessarily with the patient present. However, the guidelines go on to say that all patients should have the chance to raise questions and highlight the problems about their medicines, and that any changes resulting from the review are agreed with the patient. It also states.
Yeah, no need to read actually. That's why I put it in small letters. So here again, you see contrasting word is here, right? Nowhere else you have a contrasting word. So the answer must be soon after the Contrasting word is one of the strategies. And guidelines require means required. Requires means always it is should, not must. Guideline requires those undertaking a clinical medication review to involve the patient in their decisions. Now there are suggestions that if I highlight, you will not be able to see about medical review. Recommend other services as an alternative to medication. In the medical review, do you say that maybe when you have allopathy, do you suggest them you go for normally is it the focus to suggest in your medical reviews you have go for Ayurveda treatment in normal conditions?
No, Father.
No, Father.
Never they recommend. So it is not for general sense. It is understood. Medical review is not for that. Consider the cost of any change in treatments. Are they bothered about the change in the treatments when they do the medical review?
No,
Medical
Father.
review means it's an evaluation. They should not be bothered about any other aspects, right? There's no cost. They are not bothered about the cost. Medical review has to be done objectively. Then rest of the things can be decided by the party, not by the health professional. Am I right?
Yes.
So I am
Yes,
telling
Father.
you the background knowledge, the general sense can tell you these two are not the options. But then here after, however, it clearly says all patients should have the chance to raise questions and highlight the problems about their medicines, and that any changes resulting from the review are agreed with the patients. Involve the patients in their decisions. Any changes resulting from the review means the patient agreed with the patient means involve the patient in their decisions. Changes resulting is the decision, and agreed with the patient means involve the patient in their decisions, clearly given. And the strategy is that after the contrasting word, however, you have the answer, and rest of the things are not required.
The purpose of the email is to answer option A, report on the rise in post-surgical complications. B, explain the background to a change in patient care. C, remind staff about procedures for administering drugs. To all staff, subject, advisory email, safe use of opioids. In
This is
August,
the context. Yes.
in August, an alert was issued on the safe use of opioids in hospitals. This reported the incidence of respiratory depression among post-surgical patients to an average 0.5%. Thus, for every 5,000 surgical patients, 25 will experience respiratory depression. Failure to recognize respiratory depression and institute timely intervention can lead to cardiopulmonary arrest, resulting in brain injury or death. A retrospective multi-center study of 14,720 cardiopulmonary arrest cases showed that 44% were respiratory related and more than 35 occurred on the general care floor. It is therefore recommended that postoperative patients now have continuous monitoring instead of spot checks or both oxygenation and ventilation.
So a rise in post-surgical complications. They don't speak anything about rise. They say an average 0.5%. Means only out of 5,025, the patients will experience respiratory depression. So there's nothing to do with rise. They don't speak of rise, means there is no comparison between low and high, all those scales are not there. So explain the background to it. Third one is remind staff about procedures for administrating drugs. So the first one is report language. Second one is process or procedure, step by step, 1, 2, 3, 4. The previous session, I explained you how the particular, like in the party A, I think the text D was about a procedure. So 1, 2, 3, 4, 5, 6, 8 steps were given. So this doesn't give any steps. This process is not there. Why I'm telling you this, once you are familiar with these types of paragraphs, nature of paragraphs, or the nature of text, you can even eliminate those two without even reading the passage or looking at the text at all, paragraph, because there is no reporting language, no process or procedure language. So definitely the option is only B, explain the background to a change in patient care. And this clearly says how patient care, what has to be done, and the background is clearly explained. If you find it confusing, don't worry. We'll be explaining that in another session. So each day we are taking a particular focus. So today we have taken the thing what we have learned in our first and second session, the thing about the structure of the paragraph, how to identify the structure and locate the answer immediately. The structure was that a problem, cause, effect, solution, and compatibility and caution. So that was the thing we looked into it.
Now I'm reading part C.
Just let's listen to this one.
Question number 7. In the first paragraph, the writer uses Ivan Carter words to option A, explain the main causes of sleep deprivation. Option B, reinforce a view about the impact of sleep deprivation. Option C, question some research findings about sleep deprivation. Option D, describe the challenges involved in sleep deprivation research.
Okay. Here, first paragraph is important for the beginner specifically because you need to number the paragraphs. As soon as you get the text, read the text, try to number the paragraphs so that you immediately go to the paragraph, concerned paragraph for each question, so that you don't waste the time. And Carter's, the name is also important. And coming to the options, A, B, C, answer options, what is important?
Causes, main causes.
Causes, yeah, causes. Okay, causes.
Impact.
Compulsory about impact. See the beauty, if you have seen cause and effect language, you can see the beauty here.
Research
Yes,
findings.
Findings.
Research
Yes, findings.
Challenges.
Challenges. See, these are different concepts. These are different concepts. Now, cause, impact, finding, challenges. 4 things. Now, as you read or listen to, you have to listen to, you understand the nature of the language. So you know whether they are asking for, the writer uses those words to, whether they are speaking about cause and effect, impact, findings, challenges. So please read this small paragraph, the first paragraph of sleep deprivation. Please.
It's further. Millions of people who suffer sleep problem also suffer myriad health burdens. In addition to emotional distress and cognitive impairments, these can include high blood pressure, obesity, and metabolic syndrome. In the studies we have done, almost every variable we measured was affected. There is not a system in the body that's not affected by sleep, says University of Chicago sleep research, Van Carter. Every time we sleep deprive ourselves, things go wrong.
Now there is name here, right?
Yes.
There is name is there, the answer should be there, right?
Yeah.
And there is not a system in the body that's not affected by sleep. Says University of Chicago sleep researcher is not required.
Right.
And compliments. Okay. So every time there is not a system in the body that's not affected by sleep. Who said? Ivan Carter. He said, means every system is affected. Does it speak about in cause or effect or challenges or findings? Effect. There is not a system. Yeah, impact, effect, right?
Effect.
Impact. There is not a system in the body that is not affected by COVID-19. Means that is the impact of COVID-19 or the effect of COVID-19. With that very concept, what do you understand? What could be the answer?
B.
B.
Yes.
It's reinforce a view about the impact of sleep deprivation.
Yes, yeah, definitely. See how beautifully we can easily identify the things. Now coming to the topic sentence. What is the topic sentence?
Sleep deprivation.
Yeah. Topic sentence?
Yeah. Who suffer sleep.
Millions of people who suffer sleep problems also suffer myriad health burdens.
Myriad means plenty, many, so many health problems. So we can say who suffer sleep problems, who are deprived of sleeps. Deprivation of sleep is the cause, and health burdens is, or health problems is the effect. So the topic sentence speaks about cause and effect. What is the cause? Suffer sleep means sleep deprivation. Suffers, yeah, that is cause. Effect is health burdens. Problems. Cause and effect. So definitely the whole thing is going to speak about cause and effect. The whole text 2, I think text 2, this one, probably sleep deprivation, that will speak about cause and effect. And here you have cause, option A, cause. Definitely, you know, this here is speaking about there is not a system in the body that is not affected by sleep. That is the negative expression. If you put it positively, it means every system in the body is affected by sleep deprivation. That's how you have to make it your own.
to understand an analysis of the text or the audio in listening. Now, this topic sentence speaks about, this is going to speak about the impact of sleep deprivation, the health problems, health burdens. Now see, this is the topic sentence. Now, supporting sentence has to explain this controlling idea. This is a controlling idea. Myriad health problems, many health problems, many health burdens. What are they?
High blood pressure, obesity.
This is high blood pressure. See how beautifully they explain it. High blood pressure, obesity,
metabolic syndrome,
and
Metabolic syndrome.
Yes. In addition to emotional distress, even emotional distress also, and cognitive impairments. That's also there, but these are the main things. In addition to emotional distress,
Yes, cognitive.
and cognitive impairments also is there, but other health burdens. Now, in the studies we have done, means developing sentence, illustrating with the findings of some study. Almost every variable we measured was affected. Almost every variable was affected. This is again saying every variable we measured was affected, means there was a lot of impact. And there is not a system in the body again, that is the same thing. Every variable we measured was affected. The same thing is again illustrated, saying there is not a system in the body that is not affected by sleep. Means every system is affected. Every variable we measured was affected. Every variable was affected. Every system was affected. It's the same, says even Carter. See, developing sentence 2. Do you understand? First one is a topic sentence. Second one speaks about myriad health burdens, many of them. That is a supporting sentence. Then you have 2 developing sentences where they speak about the studies, findings of the study, illustration or giving evidence. Then how you Van Carter, what he says. That's also another illustration, evidence given by a researcher. Every time we sleep, deprive ourselves, things go wrong. Again, the same thing. Every time things go wrong. Same thing, explain repeatedly, same thing is repeated. And the easiest way I said, when you are competent, what you will do, you will look into the name here, immediately you go to the name in the text. Where is the name in the text? At the end of the text. So you don't require much time to find it out. Immediately you go to that name, author, then you see what he has said. Previous portion of that, there is not a system in the body that is not affected by sleep. Means every system in the body is affected by sleep. Reinforce a weave about the impact of sleep deprivation. Reinforcing, giving evidence, or illustrating. Reinforce means illustrate. Developing sentence means illustration of the topic sentence. So as soon as you see this reinforced word, you know the answer is, once you are competent, you know the answer is in the developing sentence. Developing sentence means at the end of the paragraph. So once you are competent, you don't need to read the initial sentences at all. Maybe if need be, you will read the topic sentence and directly go to the answer immediately in the developing sentence. Okay. Right. Hope that is clear.
Yes, Father.
How do you feel?
Yes, Father.
Let's check the paragraph structure. See, millions of people who suffer sleep problems also suffer myriad health burdens. Topic sentence. 1. What are the suffer myriad health problems? Many health problems. 1 is emotional distress. Second one is cognitive impairments. Third one is high blood pressure. Fourth one obesity. Fifth one metabolic syndrome. Means these are all impact on the effects of sleep deprivation. And the question is about effect, impact. Answer option is about impact. Effects of sleep deprivation. 1, 2, 3, 4, 5. See? Millions of people who suffer sleep problems also suffer myriad health problems, health burdens. In addition to emotional distress and cognitive impairments, these can include high blood pressure, obesity, and that is supporting sentence. In the studies we have done, almost every variable we measured was affected. That is a developing sentence. Again, you have the second developing sentence. There is not a system in the body that's not affected by sleep, says EduSkills. Chicago sleep researcher is one author. Okay, every time we deprive ourselves of sleep, things go wrong. See how beautifully sleep deprivation, paragraph structure, topic sentence, then supporting sentence, then developing sentence 1, developing sentence 2, then conclusion. See the beauty of it. This is how you have to do the analysis of the text as well as audio. The script of the audio has to be done the analysis, or you can listen to and write down this analysis as you listen to the audio. Okay, what you have to do, these questions, the strategies and tips you have to be aware of. Number the paragraphs. As soon as you start reading the text, before you start reading text, number 1, 2, 3, 4, 5, 6, 7, 8, whatever the paragraphs you have. Then title, effects of sleep deprivation. Okay, title means title of the whole text is sleep deprivation. Sleep deprivation means what happens. So the first method, foresee. As soon as you see the title, you can foresee this is going to speak about what happens if you deprive yourselves of the proper sleep, if you don't sleep properly. Third one, cause and effect language, nature of the text. Fourth one, topic sentence, controlling idea. Millions of people who suffer sleep problems also suffer myriad health problems. Fifth one, paragraph structure. Okay, these are the things you have to be mindful. See the structure, sequence, effects. Effects discussed. Effect 1, effect 2, effect 3, effect 4. Or the conclusion, link.
8. What do we learn about sleep in the second paragraph? A scientific opinion about its function has changed in recent years. B. There is now more controversy about it than there was in the past. Copyright researchers have tended to confirm earlier ideas about its purpose. D. Studies undertaken in the past have formed the basis of current research. A common refrain among sleep scientists about 2 decades ago was that sleep was performed by the brain in the interest of the brain. That wasn't a fully elaborated theory, but it wasn't wrong. Numerous recent studies have hinted at the purpose of sleep by confirming that neurological function and cognition are messed up during sleep loss, with the patient's reaction time, mood, and judgment all suffering if they are kept awake too long.
So what is the hedging word in the topic, the question stand?
We learn what we
Learn.
Learn about sleep, okay? Okay, and normally this is also known as about questions, okay? About, they're asking about something. And now coming to the first question, answer option. First answer option, what is the keyword?
Opinion.
function.
Function. It's function.
Function, okay, function, okay. Second one,
Controversy.
controversy, okay. Third one,
Idea. Purpose.
ideas.
Ideas.
Yeah, purpose. Or you can also say confirm earlier ideas about purpose. Confirm earlier ideas about purpose also you can say. Purpose also is clear. Okay. Next one.
Current research.
Basis.
Studies. No.
Studies undertaken.
Basis of current research. Okay. Because it says studies undertaken in the past, right? Okay. Coming to this text. Have a glance at the text. What do you understand from the topic sentence? Is the topic sentence. First sentence is the topic sentence. And I said it's a contrast word-based question. So where will be the answer?
After the
After the contrast word. After the contrast word, it's saying it wasn't wrong. It wasn't wrong means that is confirming the previous. Confirming what is said in the topic sentence. They are saying a common refrain among sleep scientists about 2 decades ago was that sleep was performed by the brain in the interest of the brain. But it wasn't wrong means it was right. This was, topic sentence was right. Numerous recent studies have hinted at the purpose of sleep. Purpose of sleep by confirming. Confirming what? Neurology function and cognition has messed up during sleep loss with the patient's reaction time, mood, and judgment all suffering if they are kept awake too long. So any idea?
Tend to confirm earlier ideas about its purpose.
Yeah, researchers have tended to confirm earlier ideas about its purpose because they are saying, see, earlier idea was a common refrain among sleep scientists. That was earlier idea, common refrain, common idea. About 2 decades ago was that sleep was performed by the brain in the interest of the brain. What is the purpose of the sleep? What is the purpose of the sleep? That was not wrong, but it wasn't wrong means it was right. That's being the recent studies. This was 2 decades ago, right?
Yes, Father.
This was 2 decades ago.
Past.
Now, recent studies. Recent studies. And here you have tended to confirm earlier ideas about its purpose. Earlier ideas means 2 decades ago. And now recent studies have confirmed, have hinted at the purpose of sleep by confirming that neurological function and cognition are messed up during sleep loss, which means brain functions are messed up, means sleep is needed for the function of the proper functioning of the brain. Is that clear?
Yes.
So what is the answer is C.
C.
Okay. Scientific opinion about its function has changed in recent years. This is opposite, right?
Yes.
Did not change in recent years. This is opposite of what is said in the text. Okay. And here, there is now more controversy about it than there was past. There is no controversy at all. They have confirmed it. They have confirmed the previous ideas. There is no controversy. Now they are saying there is now more controversy. That means that's also just opposite. Is that clear?
Yes, Father.
Yeah. So we can eliminate this. This is opposite to the text, and this is also opposite to the text. And the other one, studies undertaken in the past have formed the basis of current research. They have not mentioned, they have, that was the basis of current research, but they have said the present studies have confirmed the previous studies. They have not mentioned, the fourth option is not mentioned in the text. Is that okay?
Yes, Father.
Yeah. Yeah. So this is how it goes. Sleep was performed by the brain in the interest of the brain, but it wasn't wrong. Purpose of sleep confirmed. Okay, that's it. Cool. Okay, purpose of sleep. So if you want to give a heading to the whole paragraph, text, you can say the text speaks about the purpose of the sleep. That's how you have to give some headings. When you understand what is the paragraph, try to give a heading, write a heading for the paragraph. So that will help you to analyze better. Okay, that's cool. Now time expression you have recent, new, earlier, past, 2 decades ago. Contrast word, what? Compare and contrast language, nature of the text, recent years, and now. Earlier, C option speaks about earlier, D option speaks about past, text speaks about 2 decades ago. And negative sentence, it wasn't wrong. It wasn't wrong means it was right. So negative expression should be careful about. Okay, let's go to the next question. Listen and read along. Okay, let's have practice.
9. What particularly impressed Bob McCauley of Harvard Medical School? A. The effectiveness of adenosine as a sedative. B. The influence of caffeine on adenosine receptors. Copyright the simultaneous production of adenosine and adenosine receptors. D. The extent to which adenosine levels fall when subjects are allowed to sleep.
Okay, now I'm going to teach you a very new method. Now, from the question, Sam, what is important here?
Impressed, particularly impressed.
Impressed. What does it speak about? Impression, impressed?
Emotions.
Emotion. And
Bob
McCauley, the name, Bob McCauley, the name is also important. Now the options.
Effectiveness, sedative.
Effectiveness
of
adenosine as a sedative. Okay. Yeah, influence of caffeine.
Caffeine on.
Yeah. Simultaneous production of adenosine and adenosine receptors.
Adenosine
receptors. Adenosine and adenosine receptors, 2 things. Okay, and is there the extent to which adenosine levels fall when subjects are allowed to sleep? Adenosine levels fall. Okay. Now the thing is this: what are they asking? They are asking what particularly impressed Bob McCauley. Now tell me where you have the names. Bob McCauley.
First line.
First line. Now they are asking about the impression of Bob McCauley. First line, it is speaking about what?
Bob McCauley and
colleagues.
Bob McCauley and colleagues, and our question is not about colleagues, only about Bob McCauley. Okay. Now again, you have somewhere here.
Macaulay team.
Macaulay team.
Yeah,
So,
Macaulay's team.
Macaulay's
Again,
team.
it says Macaulay's team, but question is not about Macaulay's team. It's only about Macaulay's impression. This is the strategy that you will find repeatedly in OET. Okay, so when there is a name, typically a name, this can be called as moving from general to particular or moving from plural to singular. Okay, differentiating between singular to plural to singular. Now, where do you have Macaulay? Do you have anywhere only Macaulay?
Macaulay later discovered.
Yeah, Macaulay.
Yes.
Macaulay
Later
discovered.
Brain
or-
has cleverly designed.
Okay, brain has cleverly designed. Where is it? Yeah, brain has cleverly designed. Okay. Then before that, Macaulay later discovered.
That.
Okay. Macaulay discovered that as adolescent levels rise during sleep deprivation, so do concentration of adenosine. See, so do adenosine levels, so do concentrations of adenosine receptors. Both are there. Okay. They're speaking about Macaulay. Immediately you have later discovered. Okay. And multiple sleep. Magnifying the multiple sleep inducing effect. Okay. Cleverly designed. Brain has cleverly designed means, see, Shanmuga has cleverly planned her studies. Means I am impressed, right? When I give you an impression that Shanmuga has cleverly planned her OET studies, which means I am impressed. I am impressed about our plan. So this strategy you should be very particular. When there are many men, the team or the group or association and a particular person, if they are asking about a particular person's impression, just ignore other things and directly go to that particular name where you have only the name, not the team. Is that clear?
Yes,
Okay.
Father.
Now you see Macaulay and colleagues, Macaulay and team. We are not bothered about what Macaulay and colleagues found, what Macaulay and team found, but we are bothered about Macaulay later discovered. Again, what is later? Sequential expression. And I said, whenever there is any sequential expression, normally answer will be there around. And this is clear, I hope. Okay?
Yes, Father.
Yeah. Now you see how beautifully it is put up. Or particularly impressed about Macaulay. You see, findings of team versus Macaulay. Findings discussed. As I said, the paragraph structure. The two things are discussed in the paragraph: findings of team and findings of Macaulay. And we are asked to speak, asked about only Macaulay's findings. Finding 1, Bob Macaulay and colleagues. Finding 2, Macaulay's team. And finding 3, Macaulay discovered. Then the conclusion. This is a beautiful strategy that you have. See, findings of Bob Macaulay and colleagues at Harvard Medical School versus findings of Macaulay. See, Bob Macaulay and colleagues found. We are not bothered about them. Macaulay's team also found. We are not bothered about team. Macaulay later discovered. So this is the strategy that you have to be very careful. And reading for emotions, the brain cleverly designed impression, right? Emotion. Name, Bob Macaulay. Sequential expression, later. Synonyms, found and discovered. Plural versus singular, team versus Macaulay. Yeah. Where is the highlighted question? This is the highlighted one, right? 10th question. See the highlighted word, by no means the be all and end all in the third paragraph. Third paragraph we have already highlighted. You have numbered, so you know where it is immediately. What idea is emphasized by the phrase, by no means the be all and end all. So where do you have the highlighted word? Immediately go there.
Last.
Okay, last. So you need not to read everything. We have to read the previous sentence or the next portion of the sentence or next sentence. Now, where do you have? Options are sleep deprivation has consequences beyond its impact on, see, consequences of sleep deprivation. And we said the whole text is speaking about sleep deprivation, sleep debt, and its effect or impact or consequence, right? The whole text. Not only this paragraph, whole text is speaking about consequences. Second one.
Significant factor.
Yeah.
Significant factor.
Okay. Adolescent levels are significant factor. Okay.
Not yet
Then,
fully understood.
Not yet fully understood.
not yet fully understood. Okay. Importance of the link between sleep deprivation
Should not be underestimated. Link.
Underestimated. Link between sleep deprivation and adolescence should not be underestimated. Link between sleep deprivation and adolescence. Yes. Okay. Now the thing is, sleep now in general, if you just analyze it, earlier I used to teach you about the link between paragraphs. In third part C, one text, each paragraph is connected. And the very first paragraph speaks about the consequences, impact of sleep deprivation and its results or consequences. Here also definitely the whole text taste is there in the word consequences in the first sentence. That you can see in general, you can understand that way. But here, what is it? Now we will read before the this one highlighted word. What is before?
Macaulay and colleagues
Macaulay
found
says,
that infusing adrenaline into rat diesel food.
Yeah.
Down one.
Macaulay says adolescent may underline some of the cognitive features of sleep loss. What does it mean? Macaulay and colleagues found that infusing adolescent into rash basal development impaired their performance on the attention test similar to that seen in sleep deprived humans. But adolescent levels are C. There, Macaulay says adolescent may underline some of the cognitive deficits that result from sleep loss. Okay, there is cognitive deficits due to sleep loss. Okay, but then the but after but the contrast word, what you have?
But
adolescent levels are by no means the be all and the end all of sleep deprivation effects. Means that is not the only effect. There are much more effects. It goes beyond. It goes, adolescent may underline some of the cognitive effects. You see, some of the cognitive effects that results from sleep. So that is not the all, right? Some of the cognitive deficits. There are so many other cognitive deficits. Maybe adenosine may underlie some of the cognitive effects that result from sleep. That means it has much more consequences beyond, much more. By no means the be all and end all means this is not the only effect. Adenosine levels are not the only effect. Do you have any option with the same meaning?
A.
Yeah. I said consequences, definitely that is the answer. And consequences beyond its impact on adolescent levels. Beyond its impact on adolescent levels. You see, adolescents may underlie some of the cognitive defects that result from sleep loss. This is not the only result, but there are many more effects of sleep loss. Is that clear?
Yes, Father.
Yeah. Deprivation's effects on the brain. See, of all. So the previous sentence tells, even this is explaining the same thing. We're comparing to mice. Okay, same thing. This Adam and colleagues found that infusing adolescents into rats basal brain improved their performance on an attention test similar to that seen in sleep deprived humans. Same thing. This sentence is explained here with an illustration. Listen and read aloud. Then only you will benefit.
11. What was significant about the findings in Van Cotta's experiment? The rate at which the sleep-deprived men entered a pre-diabetic state. The fact that sleep deprivation had an influence on the men's glucose levels. The differences between individual men with regard to their glucose tolerance. The extent of the contrast in the men's metabolic states between sleep, debt and recovery.
Okay, coming to the question stem. What is important?
Significant findings.
Yeah, significant. What does significant speak? It speaks about, again, emotion, significance. Okay, and emotion will be expressed probably there. And findings in Van Cotta's. We are bothered about Van Cotta. Now in the answer options, What is important?
Pre-diabetic state.
Entered a pre-diabetic state. Okay. Next. The fact that sleep debt had the influence on men's glucose levels.
Men's
Then
glucose
the
level.
differences between individual men with regard to their glucose tolerance. Differences between individual men. Okay. And the extent of contrast in the men's metabolic states between sleep depth and sleep recovery. Okay. Contrast in the men's metabolic states between sleep depth and sleep recovery. Okay. Now come on with the name. Van Carter.
And colleagues.
Yeah, where do you have the names? Van Carter is here. Van Carter and colleague. Are we concerned about both?
No.
The
No.
question doesn't ask us about his colleagues. The question doesn't ask us about his colleagues. Then there is a researchers. Researchers gave the participants. Are we concerned about researchers?
No.
No. See, though these things are speaking only about them. All these things you need not read once you know this strategy. Then go to where is scattered again the name?
Last line. Van Cotter.
We knew
says,
it would be affected.
Says Van Carter. Yes, says his opinion, right?
Yes.
Yeah, and his opinion. What is his opinion? While sleep deprived, men's glucose level resembled a prebiotic state. We knew it would be affected. The big surprise, significance. What is it? The emotion.
Emotion.
Okay, the emotion. The surprise was the effect being much greater than what we thought. The extent of the contrast in the men's metabolic states between sleep depth and sleep recovery. During sleep depth and recovery, gave the participants a glucose tolerance test and found striking differences. While sleep deprived, the men's glucose metabolism resembled the pre-diabetic stage. This is the previous sentence, right?
Yes.
Then they are confirming we knew it would be affected, says Van Carter. That's his opinion. Until then, it was of the colleagues and the researchers. Okay, it was affected means sleep deprivation and men's glucose metabolism versus pre-diabetic state. Between metabolic states between sleep depth and recovery. Is that clear?
Yes, Father.
Yes,
So
Father.
the answer is here, the name is here, answer is around here. Other things like Van Carter and colleagues and the researchers in general, we are not concerned about it. Okay. See the beauty, says his opinion, says about opinion. Okay. The big surprise. Okay. A century of sleep research has revealed. Okay. That's the general statement. Then that Van Carter and colleagues, then researchers, then Van Carter alone, the big surprise. Okay. So reading emotions impression, the big surprise. The big surprise. Name. Then general to singular. Researchers over century, Van Carter and colleagues, Van Carter. See? Researchers in general, Van Carter and colleagues, then Van Carter. Let's see. Opinion word says. Now scale expression. How can you find scale expressions here? Say this one is most findings of a century of sleep research. Most of them, right? Researchers over a century. Then Van Carter and colleagues means, or researchers, again they say researchers means many. Van Carter is one. So there are most people, most of the researchers over a century, then many of them, his colleagues, researchers, then himself, one. Do you see the sequence? Okay. Going to next question. Again, lexical question. Now let's check where is the word. It is the highlighted word. Are you seeing the screen?
Yes, Father.
Yes, Father.
Okay.
Yes, Father.
It is the highlighted word. Where do you have the highlighted word? In the text?
Middle.
This
Okay,
is because
it. I said, let's go to the previous, first strategies, go to the previous sentence. Okay, what is the previous sentence? This is the previous sentence, right? This is the previous sentence, okay? And what is the subject? Sorry. What is the subject of the previous sentence? Bashir has found evidence that enforced lack of sleep is the subject. Correct? Enforced, this is one part of the results. Bashir has found evidence that enforced lack of sleep sends the brain into catabolic or energy consuming state. What is the verb? That is the subject. This is the
Singular.
sense is the verb. Okay, and this one, object. I said you have to go to the first strategy. What I explained about lexical question is go to the previous sentence and subject of the previous sentence. Here the previous sentence is enforced lack of sleep sends the brain into a catabolic or energy consuming state. This is because it degrades. It means enforced lack of sleep degrades the energy molecule and then say triphosphate. Triphosphate. Correct?
Yes.
So what is the answer?
D.
The option D, enforced lack of sleep, the subject of the
Yes,
previous
Father.
sentence. Clear, no?
Yes, Father.
Yes, Father. You can see there are only lexical question sessions which I have uploaded in the YouTube channel, EduSkills OET YouTube channel. You can watch them. I have explained the same thing over there with so many, maybe I think 6 or 7 lexical questions only in that session. Okay. This individual opinion. Again, you hear third one with the same strategy in this OET official sample 1. Okay. Let's get into it. Can you, without reading or listening, shall we do it? Okay. Just what aspect of our findings surprised? What is the edging word in the question 7?
Surprise.
Surprise. Again says the emotion, right?
Yes.
And here, Cirelli, the name. Okay. In option A,
No reversal.
No reversal.
so no reversal of certain effect of sleep deprivation. No reversal. Okay, no reversal would be the concept is. Then second one.
Mice underwent some structural changes.
That mice underwent. Neurons of mice underwent structural changes. Okay, structural changes. Then there was evidence of an increased need for energy in the brains of the mice.
Increased need for energy.
Yeah, need for energy, yes. Increased need for energy, okay. Then
Neurological response.
now could you apply the same strategy? Now find out where are the names. When the name is there, immediately go to the names. First name is here, right?
Yes, team. It's a team.
And team. Are you bothered about team?
No.
No. So no team required. Better to put it in red, right? Let us mark it in red. Okay. Then Madison's group Shirley and colleagues. See, in the same material. This is the third one with the same strategy, right?
Yes, Father.
If you know the strategy, simply go to those names. Now, coming to this one, she says. She means who?
Shirley.
Yeah. Cirelli, yes. And Cirelli says. Says is opinion word. As well as animals such as debris, signs of cellular aging that unusual in the neurons of young healthy. The number of debris was small, but it was worrisome. But the contrast word. That tells you answer will be normally after that. Okay. So worrisome. What does it say?
Emotion.
Emotion. So for question says surprise. Now here worrisome because it's only 4 to 5 days of sleep deprivation actually. After 36 hours of sleep recovery, a period during which she expected normal sleep to return, those ranges remained. Those changes remained. Means there was no. Yeah.
Change.
There was no change. There was no change. So what could be the answer? There was no change. It remained means, yeah, there was no reversal of a certain effect of sleep deprivation. Yeah. In the first paragraph itself, the 7th question, if you understand the same statement they said, there is no possibility of recovery. Okay. These changes remained means the harm that happened to the brain cells remained. That was not, even after sleeping for long duration, sleep depth was not compensated. Okay, but it's worrisome because it's only 4 to 5 days of sleep deprivation. Says really, see, again you have says really, right? She says really. After 36 hours of sleep recovery, a period during which she expected normalcy, it did not happen. Normalcy did not happen. Recovery was not possible. No reversal of a certain effect of sleep deprivation. Is that clear?
Yes. Yes, Father.
So you see here you have the name given clearly, says Cirelli. So after that, you have answers. Okay. So the same strategy for all these 3 questions. Got it? See the team, the colleagues, she says, worrisome, the emotions expressed. Okay. And found structural changes in the cortical neurons of mice. That is second option. The cortical neurons of the mice underwent structural changes. Whose opinion is that? Not Cirelli's, right? Cirelli and team, the whole team's opinion. Okay, and even this one, third one, signs of ventricular activation, which makes sense as neurons need more energy to stay awake. See, there was evidence of an increased need of energy in the brain of. So this is third option, and that is of Cirelli and colleagues. So not our cup of tea. Okay, so we can eliminate these. And the neurological response to sleep deprivation only took a few hours to become apparent. 4 to 5 days. It says 4 to 5 days. The text says 4 to 5 days
36
here.
hours.
Yeah. 36 hours. Yeah. 36 hours. Is it only a few hours?
No.
Only a few hours. Even otherwise with absolute expression you can eliminate. I don't want to confuse. That's why I did not put it here. Okay. Cool. That's also eliminated. So what do you require? So 3 questions with the same strategy, the new strategy. Got that strategy right?
Yes, Father.
Just listen and read, okay?
14. In the final paragraph, the quote from Van Cotter is used to suggest that the goals of sleep deprivation research are sometimes unclear. It could be difficult to develop any treatment for sleep deprivation. Opinions about the best way to deal with sleep deprivation are divided. There is still a great deal to be learned about the effects of sleep deprivation. Further insights could be drawn from the study of shift workers and insomniacs, who serve as natural experiments on how the human body reacts to losing out on such a basic life need for chronic periods. But with so much of our physiology affected, an effective therapy other than sleep itself is hard to imagine. People like to define a clear pathway of action for health conditions, says Van Cotter. With sleep deprivation, everything you measure is affected and interacts synergistically to produce the effect.
Yes. Now the thing is, in the final paragraph, for beginners, you should highlight the paragraph. And from Van Cotter's, the quote from Van Cotter. Suggestion. If you remember model verbs, suggestion, what model verb will be used for suggestion?
May.
Yeah, can also, right?
Yes.
What is this one? Future tense, past tense of can?
Could.
Okay, that's also speculative word, right? Could is here in the option. Okay, could. Just I'm telling you, could is there. We are not bothered about that strategy now. Now, in the first option, goals of sleep deprivation, right?
The goals of
it could be difficult to develop any treatment for sleep deprivation. Opinions about the best way to deal with opinions. Okay, there is still a great deal to be learned about the effects of sleep deprivation. Okay, now the paragraph, the quote from Van Cotter is used. Where is the name? Immediately you have to go to the name, right?
Says Van Cotter.
Where is the name?
Last Phase
Yeah,
one cut.
says one cutter. Suggestion says marking word, right?
Yes.
Says, yes. Says one cutter. What does he say?
People
Before that, but there is a contrast word here. What does it say? Answer must be
After the
soon after that.
contrast word.
Yes.
For the
So let's
After
say, yeah, with so much of our physiology affected, and effective therapy other than sleep itself is hard to imagine. If you don't understand, I said you can eliminate what is between hyphens and read. What does it mean? With so much of
Subject
our
complement.
physiology affected, an effective therapy is hard to imagine. After but, if your strategy says after but there is an answer, this must be the answer. Is there a similar statement in the options?
option B.
Option B.
Difficult to develop.
Difficult
Yeah,
treatment.
exactly same. Treatment is
Therapy.
synonym therapy. And the synonymous of what is that? Difficult to develop.
Hard.
Difficult to develop. Hard. Yeah. What is the synonym?
Hard.
Hard to imagine. See the synonymous expression. So, as I said, once you are competent, as soon as you see a contrast word, soon after that there is an answer. We have seen hundreds of examples and it has happened, right? And people like to define a clear pathway of action. Says one cutter. With sleep deprivation, everything you measure is affected and interacts synergistically to produce the effect. Again, the same thing is explained. With the sleep deprivation, everything, every organ, every body is affected. Every part is affected. Synergically means synergistically. Synergistically means together, combined, to produce the effect. Okay? Got it?
Yes.
Is that clear?
Yes, Father.
Yes, Father.
So this is a particular paragraph where you have to understand the gist. This is the introduction of the first paragraph. You can see beautifully it is written. You see all these numbers. I told you have to concentrate on these things, adjectives and modal verbs, comparison, more, and also the conjunction. So now to understand the gist here, you see, you have the American Psychiatric Association recognized attention deficit hyperactivity disorder, ADHD, as a childhood disorder in the 1960s. But it wasn't until 1978 that the condition was formally recognized as afflicting adults. So what you see, I have highlighted childhood disorder, but afflicting adults. So this whole text will speak about ADHD affecting children and adults. So there are controversies going on, whether the onset is at in the childhood, or can they get as adults, can they have this ADHD without having it in the childhood? So the whole paragraph, the first sentence, the topic sentence, or what you can call the thesis statement of the whole text, tells you what is the whole text is about. That's what you have to understand as you read the first paragraph. Once you understand the first paragraph, things are going to be very, very easy. Then you have this fact they are speaking about. In recent years, the USA has seen a 40% rise in diagnosis of ADHD in children. The US has seen a 40% rise in diagnosis of ADHD in children. It could be that the disorder is becoming more prevalent, or as seems more plausible, doctors are making the diagnosis more frequently. Now, why it is it's a big issue now? They say it could be, maybe they are using a modal verb, it could be, not sure. It could be that the disorder is becoming more prevalent, or as seems more plausible means believable. Doctors are making the diagnosis more frequently. Now you see, more frequently they are making diagnosis. Maybe in Kerala is an example, they are making more tests, so there is more data about the coronavirus or the corona affected patients. So also here, they say earlier there weren't enough diagnosis made or effective diagnosis made. Today we have effective diagnosis patterns, so that's why we have more number of ADHD patients. The issue is complicated by the lack of any recognized neurological markers for ADHD. Means neurological markers or symptoms are not very clear. So what happens? We have to rely upon subjective symptoms or some hearsay, or it's not very sure what are the symptoms exactly. And they explain, I don't want to go into detail, but only one thing I want to tell you, look at the focus or the thesis statement or the main sentence, which I highlighted with green. That is the mother sentence of this whole text. If you understand that particular sentence, it's going to be very easy to understand the following sentences. So here it says, but with a contrast here, the whole text is going to speak about childhood disorder and adulthood disorder. ADHD affecting children, affecting adults. Now let's go into the question. This is the first question. Can somebody read for me?
First paragraph, the writer questions whether adult ADHD should have been recognized as a disorder at an earlier age. ADHD should be diagnosed in some way for children and adults. This can actually be indicated by neurological markers. Cause of ADHD have genuinely increased in the USA.
Okay. So in the first paragraph, the writer questions, means there is a disagreement. The writer is not agreeing with the thing. He is questioning particular aspect. The answer is cases for ADHD have genuinely increased in the USA. Okay. He questions whether cases of ADHD have genuinely increased in the USA. And we have seen in the paragraph, it has not genuinely increased because they have put more diagnosis now and the system has improved. So it is possible that these are putting into more of diagnosis more frequently so that you have more number. It doesn't mean the ADHD is affecting more people. So the author has an apprehension, he doesn't agree. So he questions the fact whether they agree. Let's see how it works. See, writer questions the whole aspect about ADHD. They say a lot of people are suffering from ADHD now. So is it a fact? So in the first paragraph, the writer questions whether cases of ADHD have genuinely increased in USA. And the first one is adult ADHD should have been recognized as a disorder at an earlier date. They don't speak anything about earlier date. They say, but it wasn't until 1978 that the condition was formally recognized as afflicting adults. They say it was recognized. It is a factual statement. So it is not giving an opinion. So they are trying whether you can understand the difference between fact and opinion language. So here, option A says, adult ADHD should have been recognized as a disorder at an earlier date. But here they say it wasn't until 1978 that the condition was formally recognized as afflicting adults. So this doesn't go there. Means they already say factual statement they have made. By 1978, the condition was formally recognized. So that is eliminated. ADHD should be diagnosed in the same way for children and adults. They don't speak anything about diagnosis of children and adults. They say there is a difference. And it says it specifies that patients under 17 must display, means children must display at least 6 symptoms of inattention and or hyperactivity. Adults need only display 5. So this is contradicting to the statement here. So that can be eliminated. ADHD can actually be indicated by neurological markers. Nothing is mentioned about neurological marker in the whole text. So that's also eliminated. Controversy. Subjective criteria and vague and subjective symptoms all are abnormal. See, this paragraph speaks about subjective symptoms or criteria or the vague subjective symptoms. It's not very sure what are the symptoms of this particular disease. So what the author says, Richard Saul says, is like when you read, when you skim, you should look for names. So the question is here, answer is here with this name. Okay, there is one more name, but then there are 2 names. So when you look into 2 names, definitely you'll find one name in the question. Definitely you can go there. See, controversy. See the beginning topic sentence. ADHD can be a controversial condition. There's an argument, controversy. So there are 2 people arguing. And here you see Dr. Richard Saul, a behavioral neurologist with 5 decades of experience. I have striked out these parts because this is not essential. I told you between whatever happens between the comma can be secondary information, or this is called subject complement, which you can just skip and read so that you can go faster. So you can read this as Dr. Richard Saul disagrees. Immediately you can read this way, striking out these secondary informations. So under such subjective criteria, the entire population could potentially qualify. Could, again, you have model verb here. Potentially qualify means all are abnormal. If you do the analysis in this way or assessment in this way, probably you will say all are abnormal, all have ADHD disorder. So could be, again, the model verb is used. And coming to the question, what does Dr. Saul object to? Can somebody read loud? And
what does Dr. Saul subject to? A, the suggestion that people need stimulants to cope with everyday life. B, the implication that everyone has some symptoms of ADHD.
C. The grouping of imprecise symptoms into a mental disorder. D. The treatment for ADHD suggested by Dr. Barkley draws attention to the poor care given to such children.
The name you when you skim, you have to identify the name. So immediately you can launch into this one. Here there is disagrees. There's a word we'll look into the comparison of question and passage. See, Dr. Saul objects. Here it is disagrees. So the synonym is being used. Objection, disagreement. So name is given here, name is given here. So immediately you can launch into the answer. You know, read the rest of the whole part. Only if you have some doubt at the end, you can skip and go at the end. You come back and scan the whole paragraph or text if you require. But then, as usual, you can just jump looking at this name and identify this name. That's why I said skimming. The clue is name, go into the name, and immediately you understand, and you can strike out all those secondary informations between commas. What you call subject complements, which are not essential to answer. The suggestion that people need stimulants to cope with everyday life. Nothing is mentioned about they need stimulants to cope with everyday life. And he is objecting. What does Dr. Saul object to? The suggestion that people, he is not objecting to that. The implication that everyone has some symptoms of ADHD. He is not objecting to that. What is he objecting to? The grouping of imprecise symptoms into a mental disorder. So Dr. Richard Saul disagrees. Many of us have difficulty with organization of details, a tendency to lose things or to be forgetful or distracted. Under such subjective criteria, the entire population could potentially qualify on subjective criteria. So he says all will qualify, all the population could qualify, entire population could potentially qualify. Means he will say that entire population is affected by ADHD. So that is the disagreement he has. The treatment for ADHD suggested by Dr. Barkley draws attention to the poor care given to such children. Here they are speaking not poor care, this is just opposite. Here they are saying, although some patients might need stimulants to function well in daily life, the lumping together of many vague and subjective symptoms could be causing a national phenomenon of misdiagnosis and over prescription of stimulants. So they are not speaking about poor care given to children. They don't speak anything of that sort. The third paragraph speaks about ADHD and other conditions. This is the third paragraph. Non-specific nature of symptoms of ADHD. Same thing. Is opinion for assessment. Is the criteria is opinion. They are assessing whether you can understand opinion. See, again, I said children and adults. Children repeated. But it could also prove the non-specific nature of the symptoms of ADHD. Anxiety and depression or an altered state can easily be mistaken for manifestations of ADHD. So you can just read like this. It could also prove the non-specific nature of the symptoms of ADHD, which can easily be mistaken for manifestations of ADHD. So modal verb is being used, whether you understand modal verbs. So non-specific nature of symptoms of ADHD. It's not very specific in children or in adults. That's what the whole paragraph speaks about. See.
The writer regards the study of children in foster care as significant because it highlights the difficulty of distinguishing ADHD from other conditions, focuses on children known to have complex mental disorders, suggests a link between ADHD and child's upbringing, draws attention to the poor care given to such children.
Yeah, so definitely from this keyword, because they are looking for a reason. So you have to give a reason. The writer regards the study of children in foster care as significant because it highlights the difficulty of distinguishing ADHD from other conditions. So why he is giving, we'll look into the text. See, a recent study found children in foster care homes 3 times more likely than others to be diagnosed with ADHD. Researchers also found that children with ADHD in foster care were more likely to have another disorder, such as depression or anxiety. This finding certainly reveals the need for medical and behavioral services for these children, but it could also prove the non-specific nature of the symptoms of ADHD, which those are like anxiety and depression or an altered state, can easily be mistaken for manifestation of ADHD. See, the writer regards the study of children in foster care as significant because why the study of children in foster care is very important because highlights the difficulty of distinguishing ADHD from other conditions. You can see here how it is difficult to distinguish between other conditions like anxiety and depression or an altered state. There's a lot of confusion. So this linking sentence clearly speaks about this. Focuses on children known to have complex mental disorders. They don't say the children at foster care have complex mental disorders. Nothing is mentioned in the paragraph. Suggests a link between ADHD and children's upbringing. It doesn't speak anything about children's upbringing. Draws attention to the poor care given to such children. They don't speak anything about the care given to the children. So it's very clearly given. The other three options are irrelevant to the paragraph. Is about a question about gist. See, onset or genesis, beginning of ADHD. See, first sentence itself says that is topic sentence. That's what I said. You have to understand the focus on the structure of the sentence. That is, that first sentence gives you the theme or structure or gist of the paragraph. ADHD begins in childhood. Where does the onset happen? Genesis or beginning of this particular disorder. So ADHD, the thinking goes within inverted commas, you can strike out. You need not even read. That's the secondary information which you don't require to get the gist of it. So ADHD begins in childhood is the topic sentence. Then you have adult, childhood, or genesis, that is onset, adulthood, adult onset, childhood, adulthood, adult onset, subthreshold ADHD, which means childhood, youth, kids. See how repeatedly they are speaking about the particular mother sentence I told you in the first introduction, the first sentence. They are repeating the same idea in all the paragraphs using this child, adult. So the first part of this paragraph speaks about childhood onset of ADHD, whereas starting, however, with a contrast with another name as a clue for you when you skim, you have, they are speaking about adult onset. So the first part speaks about child onset, second part speaks about adult onset. So if the question is particularly from child onset, you may not come back to this particular area. You can remain here. If it is about adult onset, you can remain here. There are two questions, I believe, from this particular paragraph. The 18th one. In the fourth paragraph, see again, I said you should number the paragraph so that immediately you jump into fourth paragraph. The word they refer to. These are called referent questions or lexical questions. So what does the word they refer to? Okay, this particular word, they. Here you see, however, studies from the UK and Brazil published in German Psychiatry, see this is not relevant between commas, so I have striked it, are fueling questions about the origins and trajectory of ADHD, suggesting not only that it can begin in adulthood, but there are maybe two distinct syndromes, adult onset ADHD and childhood ADHD. So, however, there is a contrast, it's a clue for you. The answer is here, studies. Okay, from the UK and Brazil. They means refers to studies. They echo earlier research from New Zealand. Means this opinion, these studies give the exact opinion as earlier research from New Zealand. These studies from the UK and Brazil also echo earlier research from New Zealand. So they is the pronoun used or a referent used for studies. And this name leads you to this particular answer, again a clue for you to reach the answer immediately. In the fourth paragraph, the word they refers to syndromes, questions, studies, origins. So definitely it is studies, whatever comes prior to that. They, previous sentence, the subject, next pronoun. For example, I say, Tina is working hard to achieve a A grade in OET. She, then the next sentence begins, she persistently practices with consistency every day. So she means Tina. So the first previous sentence subject will be referred with a referent in the next sentence. It's so easy, I tell you, it's a primary school grammar, which you can, and you have in every text, you have two questions of lexical type, which you can easily score. Hope it is clear.
Dr. Farron suggested that the group of patients diagnosed with the adult onset ADHD A. had teachers or parents who recognize the symptoms of ADHD. B. should have consulted a doctor at a younger age. C. had mild undiagnosed ADHD in childhood. D. were specially chosen by the researchers.
Yeah, see Dr. Farron, so you have a name here. Immediately you can go to the text to find out the name so that you locate the answer immediately. Suggestion, it's a suggestion, you know. The word suggest says it's a suggestion of Dr. Farron. Let's see. See here. Now, Dr. Stephen Farron. See, all these things are there. People who had sub-threshold ADHD in their youth. And perhaps, you see, the hedging word is being used. Okay. And sub-threshold ADHD in their youth. Sub-threshold ADHD in their youth means childhood. Sub-threshold is a childhood. So that's the synonymous language being used. Let's compare. See, Dr. Farhan suggests that the group of patients diagnosed with adult onset ADHD had mild undiagnosed ADHD in childhood. Means people who had sub-threshold. Here he says, in Dr. Farhan's words, the researchers found a group of people who had sub-threshold ADHD in their youth. Means they had mild undiagnosed ADHD in childhood. The sub-threshold is the synonymous being used for the childhood. There may have been signs that things weren't right, but not enough to go to a doctor. See, here it says, should have consulted a doctor at a younger age. Should. The modal verb is used. They are assessing whether you can understand the modal verbs. So here it says, should have consulted. Here they say it was not necessary. Okay. These were like, there may have been signs that things weren't right, but not enough to go to a doctor. There was no enough signs or symptoms to consult a doctor, but the B option says, should have consulted. No, there was no symptoms to consult. It was not needed at all, but here they say it would have been recommended. Okay, suggestive modal verb is used, should. Had teachers or parents who recognize the symptoms of ADHD. Here, perhaps these were smart kids with particularly supportive parents or teachers who helped them cope with the attention problems. Supportive parents and teachers who help them cope with the attention problems. Such intellectual and social scaffolding would help in early life. So here they are saying teachers, and they did not have teachers or parents who recognize the symptoms of ADHD. They did not recognize, but they helped them out to come out of these attention deficit problems. Okay, and were specially chosen by the researchers. They don't say anything about they were specially chosen by the researchers, these students. They are speaking in general, the student early childhood ADHD. Okay, this is the 5th paragraph. And you can see diagnosis and drugs, drug companies. Again, gist, you have to understand the gist. And until the seldom diagnosed disorder. Seldom. You see the scale. Seldom means rarely. So often, always. So you see a scale expression there. Seldom diagnosed disorder. That is the topic sentence of the paragraph that speaks about the paragraph. And nowadays, however, it's common in mainstream medicine in the USA, a paradigm shift apparently driven by 2 factors. They are saying now these days, the modern trends are driven by 2 factors. See, I have striked out these things which are not essential. These are secondary informations. And marketing by, see, driven by 2 factors, rework and marketing by manufacturers of ADHD medications. Some have suggested that this, again, suggestion that this new broader definition of ADHD was fueled to broaden the market of medication. Fueled to broaden the market of medication. In many instances, the evidence preferred to expand the definitions came from studies funded in whole or part by the manufacturers. The company people, manufacturers are funding the studies, and clinicians involved in diagnosing ADHD were receiving money from the drug makers or companies, drug companies. So corruption. So you can see how they influence. Coming to the next question.
In the 5th paragraph, it is suggested that drug companies have been overly aggressive in their marketing of ADHD medication, influenced research that led to the reworking of ADHD diagnostic criteria, attempted to change the rules about incentives for doctors who diagnose ADHD, encouraged the APA to rush through changes to the criteria for diagnosing ADHD.
See, seldom diagnosed until this century, adult ADHD was a seldom diagnosed disorder. Nowadays, however, now there's a contrast coming. Nowadays, however, it's a common in mainstream medicine in the USA, a paradigm shift apparently driven by 2 factors. All those things they are saying, then they are saying how it was fueled to broaden the market for medication. In many instances, the evidence proffered to expand the definitions came from studies funded in whole or part by manufacturers. This all things say the manufacturers were controlling the diagnosis aspect of ADHD. They fueled or they controlled, they funded partially or wholly the research work or studies on ADHD. And as a criteria, they also clinicians involved in diagnosing ADHD receiving money from drug makers. There are also reports that the corruption was happening. Clinicians were getting money and they were diagnosing many people having ADHD so that the market could be fueled or encouraged. So you'll see this comparison here. Okay, influence research that led to the reworking of ADHD. The synonymous language used for influenced is fuel and involved in getting money and funded by the manufacturers. All these are influences, giving funds for studies on ADHD and also bribing clinicians and fueling or encouraging the diagnosis of ADHD, all by drug mafia or marketeers is important. So the only this particular thing is true here. First option being overly aggressive in their marketing or ADHD medication. They are not, the whole paragraph doesn't speak about any aggressive marketing strategies of particular drug company. It doesn't speak drug companies, how do they market or their aggressive way of marketing. It doesn't speak anything. It only speaks how they influence the medical professionals. Third option is attempted to change the rules about incentives for doctors who diagnose ADHD. There is nothing about rules about incentives. The whole paragraph doesn't speak anything about rules about incentives for doctors. It speaks only they were bribing clinicians or doctors or health professionals. Fourth one, encourage the APA to rush through changes to the criteria for diagnosis. Nothing is mentioned about they influencing APA. They are speaking about influencing the clinicians or the health professionals. So that also can be eliminated. Now, 6, addictive nature of ADHD. Paragraph speaks about after effects of medication, that is addiction. See the beautiful topic sentence. This brings us to the issue of the addictive nature of ADHD medication. So the whole paragraph speaks about this particular, that was the glance about the text, whole text. That is the best clue for your understanding and identifying the answers. And I'll show you how can it be done. Medication, and at the end, they conclude, say that, so more work needs to be done before we can settle the questions surrounding the diagnosis and treatment of ADHD. More work needs to be done. Means we have to do more. Whatever is done is not sufficient. That's not enough.
In the final paragraph, the word trademark refers to A, physiological reaction, A, substitute medication, C, a need for research, D, a common request.
The trademark, what does it mean? This is because the body stops producing the appropriate levels of neurotransmitters that ADHD drugs replace. A trademark of addictive substances. This is body means physiological, stops producing the appropriate levels of neurotransmitters that ADHD drugs replace. A trademark means this particular aspect is the trademark. Let's check. See, in the final paragraph, the word trademark refers to, you can easily make out physiological reaction. This is because the word body stops producing. What is the physiology? Body means physics. Physiology is synonymous used for body. So this hyphen, a trademark, means this is the trademark. So again, this is a lexical question. That's what I said. You have 2 lexical questions. Clearly speaking, the answer is just before it, before that particular question. And the last one.
In the final paragraph, what does the writer imply about addiction to ADHD medication? It is unlikely to turn into a problem on the scale of that caused by opioid abuse. Second one, the effects are more marked in certain sectors of the population. Insufficient attention seems to have been paid to it. The reasons for it are not yet fully understood.
Yes. See, at the end of it, actually, it says more work needs to be done before we can settle the questions surrounding the diagnosis and treatment. Let's compare it. Here you can see in the final paragraph, what does the writer imply about addiction to ADHD medication? It is unlikely to turn into a problem on the scale of that caused by opioid abuse. It doesn't speak about opioid abuse at all. The effects are more marked in certain sectors of the population. They don't speak anything about different sectors of population in the whole paragraph. And the reasons for it are not yet fully understood. They are not speaking about reasons are not fully understood, but insufficient attention seems to have been paid to it. So more work needs to be done. There is a paraphrasing of insufficient attention seems to have been paid to it. We have done some work, but you need to do more work. We say you have done some practice, you have been doing practice, but then you need to do more consistent practice to get a good score in OET. So more work needs to be done before we can settle the questions surrounding diagnosis and treatment of ADHD. Insufficient attention seems to have been paid to it. So they are putting in a paraphrased way, insufficient attention is paid, means we need to pay more attention. Here it says more work needs or more attention needs to be paid, or here it says work needs to be done. So that's a paraphrasing effect being used in this. And that is it.